The BAME Vision logo, 4 solid circles from left to right in colours of brown, tan, coffee and beige, with the words BAME written in white within them, with the word Vision written in tan underneath, and below the words Supporting Ethnically Diverse Communities with Their Eye Health and Sight Loss in brown.
I'm going to introduce today's webinar, which is NHS Eyecare and Support. My name's Vasani, Chair of BAME Vision. And for today's webinar, our first speaker actually had to send her apologies, but she has very kindly recorded her presentation. So this presentation is by Amrit, Sehmi, and she is going to talk about the different professionals that exist in eye care. So, you know, your O's, so your ophthalmologists, your opticians, and there's so many more. So if we can start playing Amrit's presentation, please.
Hi everyone. I'm just going to give a short talk on outlining the current eye professionals in the hospital setting. So I'm Amrit Sehmi. I'm an orthoptist, currently working at Moorfields in addition to doing lots of different other roles, but my clinical role is an orthoptist. So there are many different eye professionals in the hospital. So when you come, you might be a bit confused by all the different terms. So you might come across an ophthalmologist, an optometrist, and another word for an optometrist is optician, an orthoptist, which is what I do. There's a dispensing optician, contact lens optician, ophthalmic nurse, and now we have advanced clinical practitioners as well. So I'll talk through a few of the different professionals in a bit more detail. So firstly, we'll start off with an ophthalmologist. So essentially, an ophthalmologist is a doctor. So they're medically trained and they specialise in the eyes. So they're an eye doctor. So quite often they'll just introduce themselves as an eye doctor. And they specialise in diseases in and around the eye and injuries to do with around and inside the eye as well. They're trained kind of extensively in all parts of dealing with the eyes, and depending on where you go, you might have eye doctors that are trained and specialise in certain areas. So if you were to come to Moorfields, because we're quite a big eye hospital, you might see a paediatric ophthalmologist, so a paediatric eye doctor, but there'll also be lots of different paediatric eye doctors that specialise in different areas. So you might get an eye doctor that specialises in lumps and bumps. You might have to see another eye doctor if there's a problem with a different part of the eye, such as maybe a corneal problem. If there is a problem with the eye movements, that's a different ophthalmologist who may specialise in that. If you go to a smaller eye hospital, you may just see one ophthalmologist for all different areas. So, the ophthalmologist that I work with is the ophthalmologist that deal with the eye movement problems, and eye doctors generally can provide surgical management or non-surgical treatment of eye conditions. So an optometrist, they are experts in dealing with whether you need glasses or not. So we call that refractive error. So they look at your vision, what you can see, and whether you need glasses to help with that. So they correct visual defects with the need of giving glasses or contact lenses. Optometrists are actually trained in checking the health of the eye all around. So you will quite often see an optometrist in the high street, in high street opticians for an eye test. And we also have hospital trained eye optometrists. They're all trained in the same way, but they may prefer to work in the hospital or prefer to work in the home in the opticians. You also get optometrists who are called domiciliary optometrists. So they come home to test your eyes, especially for people who are housebound. They can also manage minor eye conditions without needing to see any other eye specialist or an ophthalmologist. How they do eye tests vary depending on the age of the patient. So if you have a child who is typically under the age of 6 years old, we usually put drops in their eyes to help us understand whether they need glasses and what the prescription is, and that can be done quite accurately after we put the drops in. If the child is older, they may be quite good at doing an eye test without needing drops, of reading the letters, and for us to be able to tell whether they need a prescription. In adults, we won't put any drops in to tell, unless the adult has learning difficulties and can't talk, etc. So we might put drops in there. Dispensing opticians are experts in advising on and giving glasses. So you'll have the optometrist who will give the prescription, the reading of what prescription we need for glasses or contact lenses. And then you have the dispensing optician who are experts in being able to give the correct type of lens and the correct type of glasses for the prescription that's needed and for the particular person. They are quite skilled in giving all the different advice on lots of different types of lenses that are available. They are quite good at taking lots of different measurements and adjustments and fitting, and they work in the high street opticians, and also you have dispensing opticians who work in the hospital as well. They're contact lens opticians. So contact lens opticians are experts in contact lenses. So they are well trained in looking at the health of the eye as well, and they can give contact lenses that are suitable depending on the health and the condition of the eye. And so again, like a dispensing optician, they will, once the optician has given, the optometrist has given the reading for what type of glasses are needed, what prescription is needed, they'll then, if contact lenses are desired or required, then you will go and see a contact lens optician to be able to help you decide and give you advice on what type of contact lens, what type of lenses there are, what's best for you. Also how to put them in and take them out as well, because that requires a bit of practice and training. And then that you'll have regular follow-ups with the contact lens optician just to make sure that everything's going okay, because it's important to make sure that we're using them correctly so that we're not affecting the health of our eyes. So next is an orthoptist, so that's my speciality. And orthoptists, generally, we are experts in diagnosing and treating eye movement disorders, eye movement problems. We are assessing how the eyes work together as a pair. So we do lots of different tests to see individually how the eyes are working, and then also how they work together. If the eyes are not working together, then we can do lots of different tests to see whether it's possible that we can make the eye work together or not, and whether it's affecting the function of your eyes. We are also experts in assessing vision, especially in patients who are non-verbal and have special educational needs. So we work with a lot of children in that area. And we primarily work in the hospital, not really in the high street. We also commonly work with patients with neurological conditions such as stroke, brain tumours, and we work as a multidisciplinary team. So quite often when you'll come to the hospital to see us, the orthoptist is usually the first person that you'll see if you have an eye movement problem or if you're a child, and then we'll work together with the optometrists and the ophthalmologists. And we also quite often work with other teams around the hospital. So just a bit about strabismus or squint, which is a speciality that we deal with. So a squint and a strabismus, it means the same thing. It means a misalignment of the eyes, so when the eyes are not working together. And you don't have binocular vision. So binocular vision is when your eyes work together and you can see 3D, but if you have a squint, you don't necessarily have that ability to use the eyes together. It can occur from birth, but it can also occur later on in childhood or even in adulthood. And depending on when it occurs, can be due to lots of different other reasons. If it occurs in adulthood, it usually the patient will notice troublesome double vision, and it could be as a result of poor health. It could also be something that was present in childhood but not picked up till later. So it's important to, if they do get double vision, to get that assessed as soon as possible, just to make sure there's nothing sinister. Possible causes of a squint is poor vision in one eye, especially if it's from childhood. So if you have poor vision in one eye, the eye is not being used, the natural tendency is to wander off if you're a child. Also, if a child needs glasses, that can cause a squint to occur. So if they're trying to focus to overcome the need for glasses, then the eyes can develop a squint. And like I said, it could also be due to poor health. Even in childhood, it could occur due to poor health or adulthood. So it's important, if a squint's ever noticed, even in either in a child or an adult, to get it seen to as soon as possible and not to ignore it. So amblyopia, another word for that is lazy eye. So lazy eye is a commonly talked about term, and quite often people get the term confused, and they think that lazy eye means when the eye wanders and it's a squint, but actually a squint is when the eye wanders, and a lazy eye is actually meaning that there's poor vision in one eye. So one eye has good vision and the other eye has poor vision, and that usually occurs in childhood. And it's most definitely, we can treat it under the age of 7 years old. Not always can we treat it over that age. And the reason for that is the visual development of a child. So up until the age of 7, from 0 to 7 years old, the vision is still developing in a child. And from the age of 0 to 7, because the vision is still developing, the vision is quite elastic. So as well as being quite poor, we can make it better. But once you hit the age of 7, it becomes more static, meaning that we can't change it, and the eye becomes like an adult's eye. So if the vision is poor, it's unlikely. There are cases where we can still improve it, but typically it's less likely that we can improve the vision once they're 7 years old. And so it's important to, if there's any concern with poor vision, to get it seen to as soon as possible. Obviously, if they're over the age of 7 and they've got a lazy eye, poor vision, rather than just thinking, oh, we're not going to be able to make it better, it's always a good idea to get an opinion, because there's always a chance that we could do something. There's lots of different ways that we can treat a lazy eye. So we can either get the child to wear a patch on the good eye to make the other eye see better, because when they've got both eyes open, the brain's ignoring the weaker eye. So we put a patch over the good eye for a few hours, depending on how poor the vision is depending on how long we give the patch for. We can also give eye drops. So we can put a drop into the good eye to blur the vision in the eye to make the other eye see better. There are lots of different causes for lazy eye. So one cause could be a squint. So if you've got one eye that's turning in one direction, the brain may start to ignore that and use the other eye, and the vision can deteriorate when it's turning. If a child needs glasses and the prescription may be higher in one eye than the other eye, the eye that's got the higher prescription, the brain will just start to ignore it and prefer to just see with the weaker prescription eye. So they may develop poor vision in the eye. If they've got a droopy eyelid and it's covering the pupil, that may affect the vision. Also, if they've got cataracts. So there's lots of different causes. They're some of the most common causes. So yeah, that's just a bit about some of the main professionals. I'll just go back to the first slide with a list of different professionals and touch on the ones that I haven't talked about. So ophthalmic nurse is a nurse they're trained in nursing, but they may have specialised in eyes, so they'll have that extra training in the eyes. They quite often help in the clinics as part of the multidisciplinary team, helping us assess the vision in children who are a bit older, where the orthoptist doesn't need to necessarily see the child, and put drops in and assist the ophthalmologist or the orthoptist or optometrist. Advanced clinical practitioner can be an orthoptist or an optometrist or a nurse that's trained, some extra training to do extended role duties. So they're kind of more recent roles that have developed. So yeah, that's just a little bit on the eye professional. So I hope you found that helpful. Thank you very much for listening.
Thank you. And I know the sound quality was a little bit distorted. So if anyone does have any specific questions regarding Amrit's presentation, we'll try our best to answer them. But if not, then we can definitely pose them to Amrit, and Amrit's happy to get in touch with people to answer their questions. So just want to say thank you to Amrit. She had a bit of an emergency, which she couldn't attend today, but she kindly recorded that presentation for us. I'd now like to hand over to our next speaker, Jayshree Vasani, who is a dispensing optician and an Eyecare liaison officer, ECLO, amongst many other hats she wears. And she's also one of our founding members at BAME Vision. Jayshree is also Gujarati speaking. So if anyone does have any specific questions and would like or would prefer to ask Jayshree any questions in Gujarati, please feel free, that the option is there. So if we could now invite Jayshree, please.
Hi, Bhavini. Thanks very much. Can you hear me okay?
Perfectly.
Yeah, great. Let's see if I can share the screen. Right. Okay. So welcome everyone to the first webinar of the National Eye Health Week. It's a week highlighting of the importance of eye care, but with BAME Vision, we tend to do things a bit differently here. So we've decided to spread the webinars out and try and cram everything together. My name is Jayshree Vasani. I'm a dispensing optician and, as Bhavini said, a member of BAME Vision. In fact, we're both members of BAME Vision, and our aim really is to reach and engage with local communities from BAME backgrounds, really, to make sure that they understand the importance of eye care, the importance of actually looking after your eyes. We want to make sure that, basically people get the same messages as everybody else in terms of eye care, and they make informed choices about their well-being and their care to do with eyes. That's the general gist of it. The mission is to tackle inequalities, which prevent ethnically diverse communities from making informed choices relating to their eye care. We want to empower people, we want to engage with them, and we want to make sure that everybody's talking to each other, because what we found is that lots of people aren't talking to each other. So you've got eye care, you've got sight loss, people, charities, and you've got the actual optometrists themselves. So there's lots of engagement going on, but is everybody talking to each other? Is that person on their eye care journey actually being linked up with everybody? And that's the idea. And on top of that, if you put somebody who doesn't speak English or doesn't quite understand what's going on, that's an extra layer on top. Okay. So we want to make sure that people understand the importance of attending appointments and taking precaution with their eye care. And we're passionate about that. So what is it about eyes that's important? So eyes really are the windows to the soul and your health. And people, that's a phrase that lots of people say, but don't really understand. So in your eyes, just like everywhere else, there are little blood vessels. And when an optometrist shines a little light in your eye or looks at your eye, they can actually see those blood vessels. And it's the only place in the body where they can actually see those tiny, tiny little blood vessels at the back of your eye in situ. Okay, which means that they can see if there's a bleed, they can see all the little bits and pieces of things that are happening. And eyes are really the very early indicators of any sort of disease or anything that's happening with your body. Your body is very clever. It gives you little signals. It's always sending you little signals all the time. I'm not happy with this. I'm not happy with this. But it's whether you actually pick those signals up or somebody else picks those signals up. And so the important thing is with an eye examination, and people actually assume that when you go for an eye examination, what do? You get a piece of paper at the end, don't you, with your prescription, and then you get a pair of glasses. And that possibly is something that, eye care professionals should be a bit more prominent about and just say, oh, actually, there's your prescription, everything's okay. No, your eyes are healthy, everything looks good there. The important thing to do is to actually highlight what's actually happening about your eye health, as well as the fact that if you need glasses or don't need glasses. So the important thing to think about there is that, anywhere else in the body, you have to cut the blood vessel to see what's going on. In your eyes, they're actually there and in situ, and you can see what's going on. Okay, so Why are they important? Well, the important thing is that lots of people don't go for an eye examination because they feel their eyes are good. They can see okay. So how do you know you can see okay unless you actually have it tested? You're assuming that you can see okay. And people do assume that a lot. But the important thing is that, you know, can they actually see okay? And the important thing is to have that assessment done. So, for example, different conditions can have different ways of showing you that things are not going on. For glaucoma, a person is losing part of what's called their visual field. So you have central vision, which is nice and clear, and that's important for seeing somebody's face, reading your appointment letter. And you have peripheral vision, and that's the side-to-side vision, the vision that you use for mobility, to get out and about, the vision that you might use for driving, okay? But with certain diseases, you lose it very, very slowly. And because we have two eyes, we don't always notice it. Now, that vision loss, the visual field loss in glaucoma, is irreversible. You can't get that back. Okay, so the important thing there is that if you had a full eye examination where they test your central vision by getting you to look down the chart, and they check your peripheral vision by putting you in a little machine with like a little dome, and they ask you to do some lights, then, you know, look at some lights and flash when you see them. That's the important thing to think about, that you're having the test and we can try and pick things up early. Things like diabetes. I'm sure there's lots of people you might know who've got diabetes. They get a screening thing coming through the post. Oh, I'm not going to be able to make it that day. Do they let people know? Do they go? We don't know. Okay. Diabetic screening, again, is a vital checkup to make sure that things are going okay. And we can check out things like high blood pressure, cholesterol, age-related glaucoma. This is just a list. I'm going to go through the list just very quickly, but you can pick up things like aneurysms, brain tumors, high cholesterol, diabetes, lupus, stroke, Lyme disease, multiple sclerosis, rheumatoid arthritis, Sjogren's syndrome, thyroid disease, and vascular disease, which is Alzheimer's disease. So having a comprehensive eye examination is really important. Okay, so age-related macular degeneration is by far the leading cause of blindness in adults, okay? And it's actually the middle central vision, okay, which is the important part that people actually recognize. Oh yeah, I can't see so well because you can't see clearly. You know, you can't see somebody's face clearly. And it usually affects people in their 50s and 60s. It doesn't cause total blindness, okay? So it's not the case that, you know, you're going to lose it all, but it does make everyday activities difficult, like reading and recognizing faces. And without treatment, it can get worse. So, you know, generally it's sort of to do with the aging of the eye, and it can happen gradually over several years. But then also people that have what's called dry AMD can also then, you know, progress to what's called wet AMD. And that can be a sudden loss of vision where you've got a bleed, okay, in your eye. So the important thing is to be aware of that, okay? The exact causes are not known. It's linked to smoking, high blood pressure, okay, being overweight, and if you have a family history of AMD. So these are some of the sort of things we're always told, aren't we? Oh, look out for, you know, this, look out, make sure you're looking after your eyes, you're doing the diet, all that side of things. But all these things combined together, you know, we are, you know, sort of trying to think about having a healthy lifestyle, but all these things build up slowly and gently, and over time you won't know. The next slide is an interesting one. It's called an infographic. And the idea with that is that basically we got together in the COVID times, we got together with a group that did sort of a translation, because we found that lots of information was getting, you know, through on WhatsApp messages, and some of the information wasn't correct. And we did an infographic, which is like a little sort of pictorial, if you like, of different strands of a story. And this one is called Mythbusters, okay? So some of the Mythbusters about eyes and eye examination is my sight is fine, so what do I need to go and have an eye check for? Like I said to you, you don't know until you actually have your eyes tested. If I wear my glasses, my sight will become worse. Well, true, you might think that, but actually your brain is a very clever organ. If it recognizes that it can see better, then it actually wants to see better. It wants you to put the glasses on, you know. If you don't know that you can see better and you're walking around in blur, you won't be any wiser. So, you know, glasses are not recommended to make money. Glasses are recommended because somebody has, you know, the optometrist has got you in the room, said, can you see the top of the chart? Yeah, I can just see the large letter, pop some lenses into the trial frame, checked your vision and said, with glasses, you can see down to the bottom line. Now, unfortunately, there are people where you can actually try and do that, and it doesn't matter how many lenses you put in that trial frame, what's called trial frame, the person is not going to see further than halfway down the chart. And that person would then be recommended to go to the hospital for further investigations. So, you know, having a pair of glasses, yeah, it's sometimes for some people it's a big thing, but the important thing is that it is correctable, okay? So the eye test will be able to tell me about my eyes, but not about my general health. That's something we've covered. What if I get the answers wrong during an eye examination? Okay, well, there is no wrong answer because the optometrist or the optician will use lots of additional tests to check your vision, okay? And they may ask you to repeat things, and you also can ask them to repeat things and just say, can you just ask me that again? Can I just check that again? Can my child have an eye test? Amrit mentioned about the critical period and why it's so important, you know, but you might think, okay, most opticians will be able to test a child over 5 because they know their letters. But equally, if you have a smaller child and you feel that the vision isn't quite there, they're not following you when you're playing with the toy, it's really important you get it checked out as soon as possible, okay? Because the sooner you, as Amrit said, the sooner you get that checked out, the sooner we can make an intervention and see what can be done. A controversial one, if my vision is bad and I drive, will the optician report me to the DVLA? Well, the optician, you know, will tell you that it's your responsibility to report to the DVLA any medical conditions like diabetes or glaucoma, and it's your responsibility as an adult to do that. If you find that you're not going to do that, then you have to have that conversation and decide what's the best way forward, okay? Because you can't put people at risk. We had a lady who came out from the eye test and said to me, your optician's just told me that, you know, I shouldn't be driving. And I said, okay, right. And she said, but the thing is, I only drive locally. I don't go very far. I know the routes, so I only drive locally. I said, okay, so you may be knocking down somebody you know then. And she said, are you being facetious? And I said, no, I'm being truthful. You know, if the vision is not there, the vision is not there. And if they've told you to stop driving, that's for a reason to keep other people safe. I understand it's a big lack of, you know, loss of independence. You know, when my dad had to stop driving, he was distraught. You know, it is difficult because it is losing your independence. But the important thing to do is to think about how else you can utilize different ways to get access. You know, there is you know, other ways of getting around, and if you need any help with that, we can always chat about that, no problem. Okay, so looking at glaucoma, we mentioned glaucoma, and who's at risk of glaucoma? Well, anyone really, anyone's at risk, but those at higher risk are people aged 60, if you're African, Asian or Hispanic, if you have any relatives with glaucoma, okay, and so that's been recognised because the NHS actually funds your eye test, so you get a free eye test if you're age 40 plus and have a close family history of glaucoma. Okay, if you're very nearsighted or very farsighted, i.e. your prescription is quite strong, so also that is something you need to think. If you use steroid medication, if you have high eye pressure, okay, if you have a thin cornea, again, these are things that, you know, your optician or optometrist would know, or if you've had an eye injury. So that, again, is something to think about. Lots of people, you know, put it off. Oh, I'll be all right. I don't need to worry about it. It should be okay. Yeah, my mum had glaucoma, but, you know, I'm 40, I'm 45, I'm fine. I can see okay. So the important thing is that if it's been flagged up already, it's good to have a checkup done. Another infographic we did with the COVID-19 team was about who's eligible, because the cost of eye tests and the cost of the glasses is something. Costing is an important factor in people accessing eye care. An eye test is a vital check on the health of the eyes, and many of the eye conditions detected, if found early, can be treated successfully, avoiding potential sight loss. That's those 3 words are what we're all about, avoiding potential sight loss. So it's recommended that everyone, including children, get their eyes tested every 2 years, unless advised otherwise by an optometrist. So if they say they want to see you sooner, that's great, then you go in sooner. So who is eligible for a free NHS funded eye test? So free to you, but the NHS obviously pays. So if you're under 16, under 19 full-time education, you're age 60 plus, if you're registered partially sighted or blind, or sight impaired or severely sight impaired is the correct terms now. If you have if you've been diagnosed with diabetes or glaucoma, you are age 40 and your father, mother, sibling or child has been diagnosed with glaucoma, Or has your doctor said, your eye doctor said that you're at risk of glaucoma, if you're a prisoner on leave. And then the other thing to talk about is, are you eligible? A person who has a very high prescription called a complex prescription, they also would get an NHS funded eye test. And then we talk about the actual glasses. You can get help with your glasses, okay, if you get any of these sorts of helps and benefits like income support, income-related employment support allowance, income-based job seekers allowance, pension credit, universal credit. And if you don't fall in any of those categories, say you're a student, you could apply through a form called a HC1 form, okay, or HC1 or HC2 form, and that you can get from your optician or from a library. You can always ask. So those people are eligible to get help with the actual voucher. They'll get what's called an NHS voucher, and they can get help with the glasses. Okay. So what actually happens in an eye examination? Okay. Well, generally it's a discussion. They will ask you how you're doing, how are you doing in terms of your glasses. Do you wear glasses already? Talk about your age and your lifestyle and your medical history. An optometrist would check for signs of injury or disease or any abnormalities in and around your eye, like Amrit said. That they are looking for disease and making sure that your eye is all doing well in terms of its appearance. Okay, your retina, which is the little camera film at the back of the eye, okay, which actually sort of captures the picture, if you like, is examined, and an OCT scan can be done. I'll explain what an OCT scan is later. The pressure inside your eye is measured, and that's the little puff test, which people worry about. And the important thing there is that's the important test to check if you have glaucoma. Your peripheral vision is checked, which is the one I was telling you. You have like a bowl, and then you're sort of given a little clicker, and they cover one eye, and they ask you to look at the central light, and there are little lights going off, in one corner, another corner. And what they're doing is checking your peripheral vision. And then generally, you have a discussion of the results, any recommendations, and how soon they want to see you. So top tips to remember when you're going for your examination: make sure you take your glasses, and if you have any low vision aids, if you're a person with low vision, take your low vision aids. Tell the optometrist or optician beforehand if you have any conditions like a hearing impairment or dementia, because then they can do what's called the reasonable adjustment, which is actually give you a longer appointment, okay, if you're a patient with learning disabilities. Or like I said, hard of hearing or dementia, you can have a longer appointment. You can be slotted in, you could say, I want to be seen at the start of the day or the end of the day, where it's quieter and you've got a bit more time to work through it. And that's reasonable. That's not, that's something you can ask them to do. Okay. And there are different ways to assess the vision as well. So like I said, don't worry if you feel that, you didn't give the right answers, or indeed your dad or mum didn't give the right answers. The important thing, if you're the carer, is to highlight any sign of change. So if you're noticing that they're bumping into things a bit more, they're knocking things down, they don't seem to be engaging, something isn't quite right, then that's important to tell somebody. The other thing to consider, certainly with a person with a learning disability, is diagnostic overshadowing, which is when a healthcare professional assumes that the patient's learning disability is the important thing, rather than exploring the full extent of the cause of the patient's symptoms. You get focused on one thing, and it's important. As a carer, you're the person that can help us with that side of things. Okay, so children we talked about. Lots of kids, they can't articulate that they can't see. They don't know that they can't see. They won't be able to tell you that. We had a young lady come for an eye examination. I think she was about 7 or 8. And I asked the mom and said, how come you come for the first eye examination with your little one today? And she said she was playing a little game at school. They were playing a game where they cover one eye and cover the other eye. And when she covered one eye, she couldn't see the teacher. So she went up to the teacher and told her, and the teachers actually let the parent know and said, oh, something isn't quite right here, and that only got discovered by chance. So it's really important that kids actually do get, looked at quite quickly. Okay, there are the important thing also with kids is myopia. Lots of kids are on screens and devices. They're not spending as much time outside, and myopia is basically short-sightedness. Okay, and it's really important that kids are actually looked at early. If you wear glasses yourself as a parent, and if both of you wear glasses, it's really important that you get your eyes tested for the child as early as possible. There are treatments available for myopia, and Bavin Shah, who's going to do the next webinar. Don't miss that one. That's going to be amazing. He's going to talk about myopia management. You can have contact lenses, specialist spectacle lenses, or eye drops. But again, your optometrist is your best person to give you some guidance on that. It's really important. NHS, like I said, funds the eye examination, and kids are visual learners. You know, that's how they learn, and they're missing out on a huge part of life if they're not learning, you know, by not being able to see well. We touched on what a dispensing optician does. I mean, it did me proud, but you know, dispensing optician is different in terms of the fact that, you know, an optician and optometrist, we have this. It's an interesting terminology. Lots of people think that an optometrist, which is a person that tests the eyes and does the prescription, is an optician. And some people think that a dispensing optician is an optician. We're both opticians in one way, but a dispensing optician actually we're skilled in advising you on the lenses. So you might need different glasses for nighttime driving, you might need sunglasses, your little one might need glasses for sport or to go swimming, you know. They might need, you might be self-employed and you need safety eyewear, okay? So dispensing opticians are basically qualified eye care professionals, and their specialty is dispensing to children and to the visually impaired. And obviously, if they go on and do contact lenses, then they can become a contact lens optician. So really, dispensing to children to the visually impaired is an activity that should be done under the supervision of a dispensing optician or an optometrist, okay? Because kids' faces are changing, and so it's important that the glasses fit really well so that they can see really well, okay? 3 C's. As a dispensing optician, it would be not good of me not to remind us about 3 C's of glasses or spectacles. Are your glasses current? Are your glasses clean? And are your glasses comfortable? So the current is interesting because we actually had a chap come in for an eye examination 2 years on, and he said, oh, my glasses are not good, etc., etc. And the prescription hadn't changed. And we were sort of thinking, well, what's going on here? And then I said, the glasses that you got last time, why are you not wearing those? Why, you know, where are they? Oh, we brought them out of the case. And he goes, they're here. So I said, well, why are you not wearing those glasses? And he goes, they're for best. So I said, sorry, for best. He goes, I just use those for weddings and funerals and things like that. And I said, okay, but then you're not getting the best vision out of them. And if you look at your current glasses, they're really quite scratched. So you need to start wearing these glasses now, because obviously the prescription hasn't changed. But what is different is that your current glasses, which is the older prescription, they're scratched and you can't see out of them so well. So that's what I mean by current, if you like. Are the glasses clean? And that's important for kids, for anybody that's using their glasses, they need to be clean, and make sure that they are clean on a regular basis. Okay, and are they comfortable? If the glasses are not comfortable, you're not going to wear them. It's quite easy and it's quite simple. So there's nothing wrong with going back to the optician and saying, to the dispensing optician and saying, or the optometrist, saying, you know, I need to get these sorted because they're not comfortable and therefore I'm not wearing them. Okay, so early intervention is the key. Some key messages here. If you are registered sight impaired or severely sight impaired, which means you have really low vision, it's really important to have an eye examination, because lots of people with sight impairment or severe sight impairment think it's not important to go and see the optician anymore, the optometrist anymore, because I can't really see that much. So, you know, what's the point? Well, as we've just said, there may be other things going on. You may have glaucoma, you may have retinitis pigmentosa, but also it may be that you might be developing diabetes. So it's really important that you have the eye examination. There may be new technologies available. There may be new therapies that your optician or your optometrist could tell you about. There may be new low vision aids. So the important thing is to keep regular touch. Okay. The other thing to think about is no one is too disabled to have an eye examination. Okay, so by that I mean that you might think, okay, I'm sitting at home, I can't get out, my child has a learning disability, he or she can't communicate. There are different ways of testing people's eyes, so it's really important that, you know, anybody and everybody can have an eye test. Domiciliary service, which is a service at home. If you can't get to the practice, they can come home to you. That's a service that's available. And just like a dental checkup, an eye checkup is really important. This slide is a general sort of slide about what's important in looking after your eyes. We talk about having a domiciliary test if you can't make it, a healthy diet, which could include things like broccoli and eggs, leafy green vegetables, oily fish, fruits and veg. Smoking is a big one. Smoking actually increases the risks of cataracts and macular degeneration. So really stopping smoking is a big push with the NHS, and also for your eyes too. Regular exercise, obviously, which keeps in check the blood pressure and the cholesterol and the diabetes. Sunglasses. Just like you protect your skin, you put, X factor on, you're really, when you're out in the sun, you're doing all of that, but are you actually wearing good quality sunglasses? So again, your eyes need protection. And safety glasses. Bank holiday weekends are notorious at A&E departments, because that's when, the wife that's been nagging the hubby to put the shelf up, decides to put the shelf up, but is not wearing safety glasses and has the accident. So again, this is important. So domiciliary eye care, I'll just go back to that. If you can't get to High Street Optician because of any mental or physical disability, an optometrist can come to you, and they can test you at home, because they have specialist equipment to do that. And again, if you need a bit more time, that's a good way of doing it. On here, the next slide is basically telling you where you can go. So the NHS Choices website, if you're based in England, is a good one to look at. The HSCNI website if you're in Northern Ireland, the NHS Inform Scotland website if you're in Scotland, and the Wales Eyecare Services website if you're in Wales. If you need any of those repeating, I'm happy to do that at the end. Now, looking at, we're nearly there, Bhavini, looking at what's going on at the moment, all the backlogs from COVID. Ophthalmology is currently the busiest outpatient specialty in secondary care, okay, and makes up at least 10% of the entire waiting list. So it's a big old chunk of people waiting there. And what they're trying to do is make things easier and trying to find out new innovative ways of trying to stop these backlogs. One of those is a use of what's called a community diagnostic centre, which is a CDC, where it's done. It's a little hub, if you like, which is in the community. So it focuses on people getting ease of access and making it convenient for people to come and be seen. Okay, so if you're a local, for example, in North London, going all the way to an eye hospital across the city might not be so good, but if you could be seen a bit more locally, then that would be good. So there are diagnostic hubs at Hoxton and Brent Cross, and they were opened as part of a pioneering project by Moorfields to continue delivering safe eye care with all the constraints of the pandemic. And similarly, a new hub recently has been set up at the Wood Green Shopping Centre. So what do they do at the hubs? Basically, you've got suitably trained eye care technicians, and they take the patient through a rapid series of tests, which are then reviewed by a consultant, okay, and their teams. And the idea is that these tests, that when you go to the eye hospital, you're waiting 3 or 4 hours to get these tests done. And actually, if this could be done by trained eye care technicians in the community, then basically they can be reviewed at a different point by consultants and their team, and that speeds things up. So the tests, which could take 45 minutes to complete, they reduce the waiting time for patients in clinic, and they provide a more efficient patient journey because it's nearer to the patient's locality. So you've got reduced travel times and less people not turning up for their appointments. Because that's the other thing. If you don't turn up for your appointment, that again will make that waiting list that little bit longer. And the community sort of hubs now can also, they're also thinking about doing that for other healthcare specialties like cardiac screening, blood tests, ultrasound, x-rays, that side of things. One last thing, we talked about an OCT scan. So what does OCT stand for? And the graphic here is if you can imagine it, Bhavini, it's an iceberg, a small iceberg with its little sort of head showing, if you like. And then underneath, under the water, there's a much deeper iceberg, okay? And OCT stands for optical coherent tomography. And it's like a CT scan, okay, of the retinal layers inside your eye. And it can document any swelling or pathology. So the idea is that, if you look at the surface, it looks like a small little iceberg, but the iceberg underneath the water is much, much bigger. Okay, and that's what it can do. And another way of describing it is if you think about a cake, if you take a picture of the top of the cake, it only shows you the top, okay, which is a retinal image. Okay, but if you have an OCT scan, it can show you the different layers and what's happening in the different layers of the cake. So it actually shows the smallest structures of the retina in really clear detail. And what it means is you can do an accurate diagnosis. The optometrist, the ophthalmologist can do accurate diagnosis. And it also means that maybe they don't need to go for extra tests. Okay, it's painless, it's safe, and it's fairly quick, about 5 or 10 minutes maximum. They might put some eye drops in to, open your eye a little bit more, so it's easy to do the scan. Last thing, urgent eye care. If you do have problems with your eyes, something urgent has happened, maybe you've had an injury or something like that, or you've got flashes or floaters or blurry vision, or your eye is red or painful, or your contact lens is causing you discomfort, or an object has become lodged in your eye, you've had an injury, then, the important person to go to is the optometrist, not the GP, because the GP knows that you have you have a pair of eyes, but isn't a specialist in eyes, okay? They're a GP, they're a general practitioner. So it's important that you go to an optometrist, and a pathway into that is, as I think Amrit mentioned it, which is called MEX, which is a minor eye care service. So what that does is use the high street optometrist to triage and manage and prioritize patients that are coming with a minor condition. Okay, so rather than sitting in A&E for 6 hours with this eye problem, you can be seen quicker. So a MEX examination provides a timely assessment of the needs for that patient. And if you do need to be referred to the hospital, they will do. But some conditions can be managed quite nicely by the optometrist, okay? And it means you don't need to go to the hospital. So like I said, if secondary referral is required, obviously they would do it, but they would do it with the appropriate urgency and say, no, Jay, you need to go and see somebody now, okay? So final slide, or final 2 slides. These stats are quite shocking. 1 in every 5 people will start to will live with sight loss in their lifetime. Every day, 250 people start to lose their sight. The main causes of sight loss, it says uncorrected refractive error, which is basically glasses, that's 39%, AMD, age-related macular degeneration, 23%, cataract, 19%, glaucoma, 7%, and diabetic eye disease, 5%. And if you are a blind or partially sighted person, or a severely sight impaired or a sight impaired person, only 1 in 4 are in work. 40% feel cut off and feel, like they've just been left behind. 17% were offered emotional support with their sight loss, and 75% have experienced a deterioration in their sight over the last 12 months. These are really hard figures, and I'm doing this slide really to try and bring home that actually, if you're on the other side of the pendulum, which is that you have sight loss, it can be quite difficult. So final shot is you only have 1 pair of eyes. Love them, protect them, and look after them. That's me done, Bhavini.
Thank you, Jayshree. That was an excellent presentation. And to finish off with, I'd like to invite our 3rd and final speaker, Ramadan Younes, who is vision impaired, living with retinitis pigmentosa. He is a journalist, a freelance reporter, and he has a fascinating story to share. So could we please invite Ramadan?
Thank you, Bhavani, and thank BAME Vision for inviting me today to speak on this important webinar. I am Ramadan Younes, an Egyptian journalist. I have an inherited retinal disease called retinitis pigmentosa. Actually, I have it since my childhood, but when I was a child, my mother didn't tell me that I had this problem because, she didn't like to affect me, my psychological status in a negative case. We as parents, shouldn't speak to their children, telling them that, look, you are going to lose your vision someday. So my mother didn't tell me about my diagnosis, but when I turned 21, 22, I noticed a gradual decline in my vision. And I decided to visit a local ophthalmologist here in Egypt to check what is going on. And the doctor told me that you have an inherited retinal disease called retinitis pigmentosa. Directly when I went back home, I went to Google on the internet to gather information about this disease. And I found out that this disease is affecting the photoreceptors that are at the back of the eye, the cells that are responsible for catching the light and transmitting them to the optic nerve and then to the brain. And I found out that this disease, unfortunately, first causes what is called night blindness. And after that causes problems to peripheral and central vision. And the patient with retinitis pigmentosa may lose their vision someday. Of course, when I was shocked by this fact, I started looking for any type of treatment on the internet. And I found a treatment offered in China. the hospital in China gave me big hope that my vision will no longer be lost after receiving their treatment. And I gathered and raised a lot of money from charities and traveled there. The treatment cost was around 12 or 15,000 US dollars. It was a surgical treatment. I had it on my both eyes. And after receiving the treatment, I found out that it was without any benefit, and my eyesight continued to deteriorate. When I visited my doctor in London at Moorfields Eye Hospital, Professor Maria Musaji, she advised me against such treatments, and she told me that most of these treatments offered in the market are some sort of scam. After I became an active member in different groups of inherited retinal diseases, especially retinitis pigmentosa, I heard similar stories from other patients traveled everywhere around the world and tried treatments without any benefits, although they paid a lot of money. I decided to speak with the BBC and tell them about this story, this untold story, and say to them, let's make a documentary about retinitis pigmentosa and about bogus treatments offered around the world to expose such practices and to try to protect other potential victims from falling into the same scam that others fell in before. Fortunately, BBC liked the story and we started working on it, I think in 2021. Yes, we started working on the documentary at the end of 2021. And the documentary was released in March. And as you remember, Vasani, you came with other patients to watch his documentary at UCL College of Ophthalmology. And I hope that this documentary will raise awareness about RP and similar inherited retinal diseases, and also to protect them of such. Some people will ask how I joined the BBC. You know, actually, before speaking about my journey with the BBC, I would like first to speak about my qualifications, about my level of education. When I noticed that I am going to lose my vision, I decided with myself to try to study hard and excel at my university to stand out as one of the best, because as you know, it's not easy for visually impaired people to get a place into work because, you know, the difficulties that we have. I graduated from a local university here in Cairo with a very good degree. I was a best second student. And after that, I got scholarship from my university to study my master's degree. And also I got my master's degree in journalism. And after taking my master's degree, I started to look for any job in them. It wasn't easy because not many people, not many employers believe in your ability as visually impaired people to excel in such a challenging field like journalism. But I decided to equip myself with learning different techniques, especially with treating with electronic devices like mobile phones, like computers, to be able to continue looking for jobs. And in 2018, I heard about a scheme the BBC has initiated for talented journalists with disabilities outside the UK. I applied for this scheme and thankfully I was chosen to be one of best 10 journalists with disability out of more than 300 applicants. And since 2019, I started working as a freelance reporter with BBC documentaries, investigating any kind of inequality, injustice, corruption. And in 2023, this year, finally, we finished the documentary that I spoke with. I hope that everyone here did not watched the documentary yet, the documentary's name is Blind Faith. You can find it on BBC iPlayer, BBC app, and also you can find it on BBC World Service YouTube channel under the name of My Undercover Journey, Exposing the Doctors Exploiting Patients Like Me, because this is really very useful, and well, it's very important to share it between us and with others, with other patients and their families, because I'm sure that many patients will try to do anything, and even their families, to try to find a treatment or a cure for the disease of their children. So I hope that all of us will help and share this film into our societies. I'd like to give some advice for everyone attending today about how we deal psychologically with our disease, whether you are affected with RP, Stargardt, LCA, or any other diseases like glaucoma or optic nerve atrophy or age-related macular degeneration. First of all, if the parents found out that their child is affected with any of these diseases that cause gradual vision loss, it's very important not to make the child feel anything, because at this age, children are very sensitive, are emotional, and if they found out that they have such diseases, they might not be able to study, they might not be able to think in positive way. So at first, we should avoid telling to children, the facts of their disease in this stage. I'm not telling that we should hide everything. No, of course, we should protect them, for example, by telling them, don't stay a lot of time in front of screen or video games or in front of your mobile, but we shouldn't tell them that you are going to lose your vision, because it's very shocking, it's very frustrating. And after the child himself feels that he experiences a gradual loss of vision, he will start to ask himself, what is going on? Here, also another role for the parents of how to support the child in this stage. It's very important to help him complete his education, because I found that unfortunately many people don't complete their education and they stop after middle school or high school. So it's very important that we support our children to make them successful as much as they could, and also to equip them with all technological aids. Now, thankfully, for people with visual impairments, we have different technological aids, as I said, like screen readers. This was not available for years and years ago, but now we can use mobile phones, we can use laptops, we can write, we can read, we can send emails, we can even work as journalists. And this is my case. It's not going to be easy, but also I always say that any easy thing, if we don't do, it will be difficult. And if any difficulty thing, if we don't try to make it easy, it will remain always difficult. So it depends on what we want, and it depends on how much you trust and you believe in yourself. Also, when I work with the BBC currently, I don't represent myself as visual impaired. No, I don't want to achieve success for myself, but for millions of visual impaired around the world, because we need to change the image towards us. Unfortunately, many people still think that if you have a visual impairment, you should stay home and get some help, financial help from governments. This is not correct. We can do great things. We can be successful like others, and sometimes better than people with full sight. So really, I am happy to help anyone or to work with anyone with visual impairment, even psychologically, to speak, to put a plan, to help how they can achieve success, whether in education or in their work. Also, a final thing I would like to speak about bogus treatments. It's a documentary that I made with the BBC focused on different treatments in different regions The first treatment I spoke about in the film was located in Palestine, in Gaza, and in East Jerusalem. The doctor there was claiming that he is able to treat retinitis pigmentosa with stimulating the retina cells by using two vibrating devices. The first device was a pair of glasses, and the second device was a device that being put into the nose. And of course, this without any evidence. The second treatment we focused on in the film came from a very well-known hospital in the field of ophthalmology, which is Fyodorov Eye Hospital in Moscow. I think many of you may have heard about this hospital. This hospital, unfortunately, claimed that they can't stop the deterioration of the sight loss, whether you have RP or even other similar inherited retinal or optic nerve diseases, by injecting the eyes with some vitamins. And of course, this without any scientific evidence. The third treatment was very surprising because it came from the United States. All of us used to look at treatments from the United States as very trustworthy. And I am saying, yes, this is true. Most of the treatments that offered in our state, should be approved by the FDA. But we found out that there is a clinic in Florida. They offer stem cells taken from patients' bone marrow and injected them into the eyes of the patients, claiming that this treatment can bring benefits to the patient's vision. Unfortunately, this treatment is not working, although it cost more than $20,000. And in the film, we spoke to a patient who had this treatment, and he lost his vision immediately in one eye after receiving the treatment. So also, I would like to speak about hopes in the future, because the future brings hope for coming up with different treatments, approved treatments, and currently there is a number of clinical trials trying to find treatments for retinitis pigmentosa, Stargardt, LCA, and others. Just patients should be patient, and when they hear about any treatment for their condition, they should first consult their eye doctors. They should do their own research and wait. Don't try to pay the amount of money required before you are sure that this treatment is really approved. Because as I said, unfortunately, now in the market, there are many bogus treatments. The aim of it only to take the money of the patients, and they do not care about the health of your eyes at all. I think I now finished my work, and I'm ready for any questions, and I'm happy to answer anything.
Thank you so much, Ramadan, for an empowering and authentic lived experience account of your journey. And I say empowering because I think it was empowering, and it was real, because I'm sure it wasn't easy, going through that process of trying to search for hope, trying to search for a cure. I've been there, and I know many others have been there. And then to have that reality broken when you've already lost thousands of money just to realize that actually it was a scam. So, the work you've done into raising that awareness and creating blind faith, which the documentary link we will share with everyone, was absolutely fascinating realization. So thank you so much. And yes, if anyone does have any questions for perhaps Ramadan or Jayshree, please either put them in the chat, put your hand up.
There has been a few on the chat.
Yeah, do you want to read them out?
So whoever's called iPhone has said, is there a possibility for people with low vision or who are visually impaired to find a job? As I think the chances of finding jobs in our case are harder.
I can start, and then either Jayshree or Ramadan can jump in. I agree, they are harder, but it is possible. There are many visually impaired employed people doing a variety of jobs, both in the sight loss sector as well as in corporate companies, from lawyers to solicitors to campaigners. There's the technology advisors. There's a wide range of jobs, and with the help of access to work, you can enable you to enhance and be possible that you can actually work. And there are different organizations. So at Thomas Pocklington Trust, we have a Works For Me program, which is specifically for blind and partially sighted people, that helps with CV writing, interview preparation, job hunting, and interview techniques. And RNIB do a similar thing. There's an organization called Blind Ambition, so and also Blind in Business for graduates. So there's a variety of different schemes and charities supporting to help you get into that step. What I would say, touch typing and having that little bit of knowledge about technology in basic skills, I think is a great start. So if there's any localized support you can get in terms of getting yourself trained and skilled, that would be good. But again, these charities that I've just mentioned can help and guide you in the right place. Does Ramadan, Jayshree want to chip in anything?
Hello, Bhavani.
Mm-hmm. Yeah.
I just wonder if anyone speaking Arabic would like me to translate briefly what we said so far.
Yeah, if there's anyone out there that does want the talk in Arabic, please do let us know, then we can do that. Or maybe we can record your presentation again separately and then have that as an Arabic recording as well.
There's a question from Mary on the chat. How do you clean your glasses properly?
Sure, hang on. Sylvia's got a hand up. What did you want to say, Sylvia? Do you want to unmute?
Yeah, okay. Can you hear me?
We can.
Okay, so Jayshree, you mentioned something about if you wear glasses, then you should make sure you take your children to get their eyes tested.
Mm-hmm.
I was just wondering if that's for everyone, or if you just have myopia, or any eye condition.
Everyone's kids should get their eyes tested. The myopia thing is, if you are already a parent who wears glasses or contact lenses, then obviously the important thing there is to make sure your children don't have that same sort of problem. And if they do, it's fine because it can be sorted. But the important thing is to take them early. So all children, doesn't matter whether you have myopia, hyperopia, lazy eye, whatever you have, the important thing is to get your vision assessed. Going back to the first question about people with low vision and visual impairment finding a job, technology is a game changer. Believe me when I say that. Technology is a game changer. And Ramadan is a fantastic example of what can be achieved should you have the mindset to achieve it. Nothing should stop you. Nothing. If you want to achieve something, you should be able to achieve it. It is easier if people help you along the way, if people have an understanding, if people can empathize with your situation. But the important thing is that you may want to work for the police. Okay, you may not be able to go out and chase criminals, but there are different jobs in the police. There are different jobs in every sphere of any job, any life, any arena that a person with a visual impairment can do. And technology has made that possible. Who thought that we would be doing things on Zoom as much as we are? Okay, it's taken a pandemic to get there, okay, but Zoom is the norm now. People jump on Zoom like that, whereas 10 years ago Zoom was like something that was in the middle of the back of somebody's technology hub, which they might just bring out. So the important thing is focus on what you want to do, pardon the pun, but focus on what you want to do and go and achieve it and get the right people on board to help you. As Bhavini said about the charities that are available in the UK, access to work is a government grant that's the government's best kept secret. Okay, there is about £60,000 available per person, okay, for anybody with a disability. And now that might sound like a lot of money, but if you want to say a person with a hearing impairment and you need a BSL interpreter, that could be £65 an hour. So you can get through that grant quite quickly. However, working being able to talk to your boss, telling him you're struggling, him or her you're struggling, and you know, there is a scheme called Access to Work, which you can both you know, have the person with the vision impairment has the assessment. It's important that you continue work, you continue contributing to society. So it's really important to get that message out there.
Do you want to cover the other question about cleaning the glasses?
Cleaning the glasses, definitely, yeah. Your glasses should always be cleaned wet, not dry. By that I mean, you know, people take their glasses off and what do? They use their handkerchief or a bit of their shirt or whatever, and it's all dry. So you're rubbing in whatever's on that lens that you're trying to get off. So run them in the water, use a little cleaning spray, always clean your glasses wet, not dry. That's the important thing to do with glasses. Also, if they have a reflection-free coating, again, make sure you follow the instructions on how to clean them, but always clean your glasses wet, not dry. That's the simple sort of way to clean glasses.
And
Jayshree, there's another question for you from Urmila. Hello, Jayshree. Why do some young, intelligent pupils do not still wear their glasses? How could we persuade them?
Right, so it's an interesting one because as a child, I don't know whether people remember, but I had glasses when I was little, and I had the NHS glasses, the little pink fleshy coloured glasses, okay? And, you know, I had them for a year, and, you know, my mum went to the parents' evening and they said, oh, I think Jay needs some glasses because she's not seeing very well. And mum goes, she's got glasses. And she goes, oh, well, teacher goes, we haven't seen them then. We've not seen her wear the glasses because she's obviously struggling. So I got home and, you know, when she got home, my mum said, what is going on here? Because you've got some glasses and my brothers, all three brothers wear glasses. In fact, everybody in my family wears glasses. I just said, I'm not wearing those. They look horrible. I'm not going to wear them. They make me look silly. And that's it. That's the end of it. So my mum goes, so you can't see then? I said, yeah, I'm not bothered. I just copy off my friends. That's how they know I'm cheating because, you know, I copy the same mistakes. Okay. So that's how the teacher was like, okay. In the end, my grandma, my mum and myself actually bought a really nice pair of glasses together. So people have to be able to choose their glasses. Young people particularly want to be able to choose their glasses, and if they pay something for the glasses, they will look after the glasses, as I did. Okay, so the important thing is to empower them and say, okay, you've got glasses, there you go, let's get something nice, something that you want, and then move forward. And if they pay for the glasses, they will look after the glasses. That's the worry with mums and dads. If I pay a shed loan and then they break them and do this and do that, what's going to happen? The important thing is they have to be empowered. They have to understand it's important so that they can see better and progress, but they also have to know that, you know, they're empowered to do what they want to do. Does that help?
Thank you, Jayshree. Thank you so much. That's
okay.
Amazing.
Anyone else got their hand up or anything in the chat?
Permjit has got her hand up.
Hi, Perm. You're muted at the moment, I believe.
Can you hear me?
Oh, now we can. Yeah, hiya.
Yeah, hi. It's all right. Brilliant presentations from everybody, but I have a question for Jayshree. Jayshree, with eye drops, why is it so difficult? Why is there such a shortfall for anyone with either macular or edema problems? It's very difficult to get your eye drops. What is the issue there across the hospitals and across the pharmacies?
Yeah, so eye drops is an interesting one because when people get eye drops, they just get told you need to use the eye drops and just collect them at the pharmacy. People are generally not told how to use the eye drops, why they need to use the eye drops, how to put them in, what's important. If you've got a visual impairment, how are you supposed to put an eye drop in? You know, are you going to use, if you touch the nozzle, then that's a definite no. You can't do that because that means you've infected it. So you can't use your hands to do that. So people are not taught how to put eye drops in. People don't understand why eye drops are important, okay? We have people with glaucoma. I work with a colleague of ours, Pavini, you know, Subhash, who's absolutely, you know, the eye drop expert. And the important thing is people don't understand why they've got their eye drops. They don't know when to put them in, how to put them in, and nobody really teaches them. And if those things are done, then the person is empowered again to do what they're supposed to do. Eye drops are important medication, and it is important that you learn how to put eye drops in, okay? And if it means you have to go back to your pharmacist and ask for that consultation, go and do it. There's a really good website called Know Your Drops, okay? And that's a Moorfields website. and they have videos on there of how to put your eye drops in, and also they have things which are called compliance aids. So sometimes people have difficulty squeezing the bottle, maybe that, you know, they've got arthritis, or they just can't squeeze it hard enough. There are compliance aids which are available, which you can get from a local pharmacy. And again, on that website, Know Your Eye Drops, you can actually see different it's not one compliance aid, different compliance aid for different drops. But the important thing is that, you know, patient education is key in using eye drops. People don't use them, they don't understand. I put an eye drop in, I don't feel any better. If I don't put the eye drop in, I don't feel any worse. So they don't use them.
Yeah,
If I put it in and I can taste it, then I stop using it, because that's horrible too. And also the final thing is, people are not told how to use them. When you put your eye drop in, the important thing is, once you put the eye drop in, is to actually close the puncta, which is the little sort of fleshy area in, you know, in the little sort of corner of your eye, so the eye drop stays in your eye and actually coats the eye, rather than going into your nasal tract and into your throat, and that's making you feel it. Does that help?
Yeah, I was thinking there is a shortfall, there is a shortage with eye drops. What is the issue there?
I'm not sure myself. I have to be honest. I'm not an expert on that, but I can certainly find out for you if you want specifics. Just email Bhavini and we can try and help out on that one.
Yeah, thank you.
If you join, or anyone else interested in dry eyes eye drops, you need to join webinar 6.
There you go. She's on it.
Vash will be presenting, and that's specifically on this topic, and you'll get all your questions answered.
Thank you. Thank you.
I think we can squeeze one more question in.
Hello.
Is there anyone got their hand raised or in the chat?
No hands raised, but Eamon put something up here. What should you do if you notice symptoms? There are local variations in availability of minor eye care services and the quality of advice.
Yeah, it is difficult. I agree, Eamon. There are, you know, it's a postcode lottery, as is all of eye care in a way, which is a shame. But the important thing is that if it is an eye injury, okay, then normally you would phone, you would go to A&E or call 999 and see what they say. If it's an eye injury, if it's something that you think that's important and you feel you might lose your vision. The important thing is to get the advice as soon as you can, and make sure that you follow the advice. And if that means turning up to an eye hospital, then that means turning up to an eye hospital. It's the important thing is that weekends, you know, like you say, if the GP isn't available, you know, they've got some locum on, or NHS 111 is really busy, it is difficult. But the important thing is to get quality advice and make sure. That's why it's important to have an optometrist in a way. They may not be open on Sunday, true, but the important thing is to have somebody local that you can go to, somebody who's trusted, and then, you know, you hopefully will get some sound advice. The important thing is to go and see an optometrist at some point, and also make sure that if nothing is available, you actually do go to an eye casualty and get seen.
Thanks, Jayshree. It's just that, I mean, I haven't got much time now, but I had an experience last week or so when I had conjunctivitis. Eventually that was diagnosed, and I had quite a lot of time bouncing around primary care.
Yeah.
In the next service, there's a website, just so everyone knows, a primary eye care website where you can put your postcode in. It tells you if minor eye care service, except the information on that's not always up to date. So the practice I was sent to doesn't actually part of the scheme.
I was just going to say the information.
Yeah, I mean, so
it's there.
But it's there, yeah. So you've just got to be persistent. I would say so. Be persistent, be your own advocate. Don't take no for an answer.
Absolutely. Because with, say, something like a detached retina, the timing is very crucial, really crucial. Okay, you have to make sure, if you feel that, you know, you're getting flashes, floaters, and, you know, something isn't quite right, you might get a curtain, something like that. The important thing is to be seen as soon as possible, because, you know, there's a time scale in terms of trying to get that retina back on again and being seen. So yeah, don't give up, just keep going.
Right, thanks.
Thanks, both. We're going to do a quick last scan of the chat just to make sure we're not missing anyone's question. Whilst Minal is doing that, can we have the poll up? I would really, and everyone at BAME Vision would really appreciate if you're able to complete the poll, as it helps us with content and just figures about how you're finding the topics and the presenters, and it helps us for future webinars. So if you are able to complete the poll, we'd really appreciate it.
Right, final question from Roro.
Mm-hmm.
Why aren't there institutions that financially support the treatment of patients?
Oh, that's a rather large question that I wouldn't be able to answer very quickly. I think that could be a webinar in itself, to be fair. I think yeah, like I said, that one also, it's a valid question. Don't get me wrong, it is a valid question, but I think it's a big question to open up and actually have a discussion about. And like I say, maybe one for next time, Bhavini. Who knows?
Yeah, definitely. We'll definitely keep that question and perhaps look into it, and maybe
Absolutely.
Yeah, it could be a future webinar and exploring all the various options that could be. And like you said, why isn't there something in place? So yeah, that's the whole research and a big question in itself.
Exactly. I see one final question, which is, my question is for Ramadan. As a researcher, what do you expect treatment will be available in the market for your condition, or in the market? Ramadan, can you do that one for us?
Yes, talking about potential treatments for example, retinitis pigmentosa or similar inherited retinal diseases. Currently, there is a number of clinical trials looking into finding treatments for such diseases, and hopefully, I expect, according to the pathways or the timeline for these clinical trials, as we all, most of us know that for any companies to get approval, they must do 3 phases clinical trials. Some of the companies that are conducting clinical trials at the moment have finished 2 phases. Some of them are conducting the last phase. So I expect that there will be a treatment. We will start to see treatments maybe in 2025. All of us know that currently there is only one approved treatment for retinitis pigmentosa, which is Luxturna, and it's only available for a small percentage of patients who have a specific genetic mutation called RPE65. But as I said, in the near future, maybe starting from 2025, we will start seeing different treatments for other patients.
Great, thank you.
Absolutely. And if anyone has RP in their audience or another retinal dystrophy, if you just want to know what the latest research or clinical trials are taking place, Retina UK is a fantastic charity that updates. So, please do check their website out, because it does regularly update it with upcoming various trials or updates in research that are taking place. So it's worth checking their website or signing up to their mailing list, because they do send out monthly bulletins for people living with retinal dystrophy. Thank you, everyone. I'm just going to check because I can't see the screen. Is the poll up?
Yes, it is.
The poll is up. Yeah. So if you are able to, please do complete it. And whilst you are completing, I just want to thank each of our speakers today, including Amrit, who shared her video, Jayshree and Ramadan. I think that was excellent, very informative, even for myself. And I hope everyone who joined us today, both on Facebook, if you're watching us, or who have joined us via this Zoom, I hope you all found it informative. I hope you'll join us on Thursday. That's the second webinar, Myopia and Me. We referred to that a little bit throughout the presentation. Myopia, also known as short-sightedness, but we'll talk about Bhavin Shah, who is an international expert. He'll be talking about signs, symptoms, management options for kids and teenagers, and so much more. And of course, we've got Hassan Khan, who's our lived experience speaker, who is living with optic nerve atrophy. I hope I've said that correctly. So yeah, please do join us. It's the same link that you got today. We're keeping the same joining link for each of our webinars. So thank you so much for joining us, and hope to see you on Thursday.
Thank you very much.
Thank you very much.
Thanks, Bhavini.
Enjoy
Thanks,
everyone. Thank you.
Thank you.
Good night.
Bye.
Good night. Good night. Bye-bye.